Thank you again for joining us. In today's episode, we're going to be talking about a prognosis. And what is a prognosis? It's a really big, scary word. What is my prognosis? What's a prognosis and got to do with cancer?
Prognosis is that one word that everyone wants to know, but often too scared to ask. Because prognosis is essentially asking, am I going to live? Am I going to survive this cancer or not?
Is the prognosis a yes or no question? When someone says to me, my prognosis is, I'm either going to die or I'm not going to die. Is that everything that it encompasses, or is it more holistic, more global?
Prognosis is a discussion.
Okay.
And it's a discussion whereby we look at various factors. And it's about the chances of survival. With some diseases, you know that they are not curable. Not all cancers can be cured. There are some cancers that can be controlled, but not cured. And it's to understand that difference and have that discussion with the doctor as early as possible so that we can have realistic expectations. So often a patient with a disease that is not controllable or not curable will be expecting those two outcomes, and family members being bitterly disappointed when that is not the outcome. And still, even with a great prognosis and very, very good outcomes, and everything is looking particularly positive in terms of that specific person with that specific diagnosis, there's still no guarantees that the treatments that are available for that person will indeed be successful.
And the opposite side of that coin as well.
Exactly right. We get surprised all the time where you have a person with a relatively poor prognosis who in fact exceeds all expectations and do so much better than was anticipated or predicted from the start. But essentially, am I going to survive depends on many, many factors. And the truth is, nobody can answer you up front. We can only quote on statistics. So prognosis depends on factors such as the type of disease that you have. It depends on the stage of the disease. Has it started spreading? Is this advanced disease or is this quite a new disease? Is the tumor behaving aggressively or not? In other words, the grading of the tumor. There are other factors that are involved in this as well. My age will determine how aggressively treatments can be given to me and whether I will tolerate them or not. Because of the fact that I may have a pre-existing heart condition or a kidney condition, may exclude certain medications from the list of possibilities. Having comorbidities can definitely influence what treatments you are able to withstand or not. So it's not just as simple as that's my diagnosis, the grade and the stage of my tumor, and you can take it even further than that, not just my age and my comorbidities, but also, unfortunately, my financial resources that are available to me, because that can predetermine your chances of survival. If you are able to access these really expensive treatments that are the gold standard in the world, is wonderful, but not all of us can do that because they're very expensive. Or perhaps my access to a treatment facility is just too far for me to get to. It costs too much money in terms of transport, in terms of taking time off work, to make that not an option. So it's very personalized, it's very individual. What are my chances of survival is a multifactorial approach that needs to be considered.
So the prognosis is a conversation with the clinician or the doctor, the medical person that I'm dealing with. How would I ask them for my prognosis? And what can I do to prepare myself for that answer?
Again, I strongly recommend that a loved, trusted person is with you at the time for support, because it's a very difficult question to ask. And it's also a very difficult question to answer. It's a very uncomfortable question for the doctor to have to answer, because sometimes it's not what you really want to say. How you ask it is in the way that comes most naturally to you. I'm frightened of this diagnosis. Does this mean I'm going to die? Doctor, are you confident that there are treatment options available for me that can cure me? Or is cure of my disease not a realistic expectation? Is it rather to try and control my disease? And it might be that we've gone past that option as well. So how can we together work in trying to improve my quality of life for whatever time I may have left?
And if I have been given a poor prognosis from my medical team, my doctor, how do I go about hearing that? How do I internalize that information? How do I process that?
Often quite slowly and in sections and in chunkfuls, and asking lots of questions and repeated questions. So you've heard something you thought you heard, maybe I misheard. I go back to what I wrote down in a journal. I speak to the person that was with me in the interview. I go back to the doctor and said, are you sure? I don't think I understood it. Could you repeat it for me? Can I repeat it back to you so you can tell me if I've heard that information correctly and I've understood it correctly?
So sometimes it may be simple misunderstanding. Sometimes it's not a misunderstanding, and in fact it is a poor prognosis moving forward, and that too is manageable, and there will be solutions that that will be provided.
I think it's so important when you have a diagnosis of cancer to not take on that journey alone. Surround yourself with people that will support you, true friends, dear family that have your best interests at heart, that you can lean on. And there's so many different ways that you can lean on these special people that will surround you, that will make the burden a little bit easier for you. And by sharing these experiences, strangely enough, it becomes easier for them as well throughout this journey.
If I am the trusted loved one of the family member, what would my role be in helping them walk through this process? And I understand that that's a very, a very in-depth question that would take an entire episode, which we'll eventually get to. What would my role be in that situation? I'm taking notes, I'm sitting there alongside them. How can I support my loved one?
What a great question. Exactly what you've just asked. How can I support you? What is it that I can do for you that will make this journey less frightening? Do I need to take your dogs for a walk? Do I need to drive you to treatment sessions? Can I look after the kids? Can I make food for you? There's so many different roles that can be assigned, in fact, to various family members. So you can say, this particular friend is really good at chatting. And in fact, today, I just want to hear gossip, light gossip that is of no consequence, and this is the friend that will do it with me. And that's your role, to keep me distracted for a little bit and keep me joyful for a few moments. And there's another family member that will speak the absolute brutal truth to me and will keep me on the hard and straight if that's what I need at that moment. And there's another kindly soul that will perhaps arrange flowers in my home and make it look beautiful, and send me little WhatsApp messages to check in on me and see how I'm doing. All of those are incredibly important support mechanisms that you can put in place using a whole lot of different resources within your personal environment just to walk the journey with you. And they would do it willingly because everybody wants to help.
Everyone can do a small role. Doesn't
Everyone
have
can
to
play
be
a small role.
Doesn't have to be a big role. Doesn't have to be a big gesture of care, a big gesture of you have cancer, oh no. It can be a small little task that gets covered, that makes the day a little bit easier to live.
Sometimes people don't want to talk about their cancer, but just the fact that they've got somebody sitting there with them, having a conversation, trying to normalize their life and recognize that life goes on is very, very important. So some of my patients, when we're having an interaction, when we're having a conversation, I'll say, today we're not talking cancer. Today I want to talk about my dog, or I want to talk about my grandchild, or the results that I've just had in a matric exam. And that's okay.
Normalizing life.
Normalizing life. Life goes on.
We're here to support you in your journey. To learn more about cancer and how to manage it, join our community and empower yourself with knowledge and resources to make informed decisions about your health. Thanks for watching, and we'll see you in the next video.